welcome back. For today's episode, we have another very special guest to me. We have Dr. Naomi Bailin. She is a doctor of physical therapy and she received her degree from Stony Brook University in 2013. Naomi also happens to be my mom's physical therapist as well, which is how we originally got connected. In addition to being a doctor of physical therapy, Naomi also has her certification, her Certified Strength and Conditioning Specialist certification, CSCS, and a couple of other very specific ones in the field of physical therapy. I originally reached out to Naomi over 2 years ago now when I was looking for a dual trainer slash therapist to work with my mom. And when I found her, we hopped on a phone call and she went over her philosophy of training and therapy, and it just sounded perfect. And being in the exercise science field for the past decade, I was trying to convince my mom to do some form of loaded training just because I knew that it would help her, especially in the long run, and it was difficult to make any long-term consistent progress here. And then after a month of working with Naomi, my mom was calling me saying that she wishes she started earlier. She was able to walk for longer distances. She wasn't in as much pain, and she was able to play with her grandkids in a much more active manner. So it's been 2 years now, and I feel so grateful to have found Naomi, and the fact that she has had such a profound impact on my mom's overall health and well-being. It just made sense to get her here on the podcast so she could share some of her experiences with you all. In today's episode, we discuss some of Naomi's specific strategies for working with joint pain, tendon pain, and how she improves overall strength and well-being in her clients. It was a very practical episode, and I hope you all enjoy.
It's recording.
Okay.
I
All
hope
right.
so.
We'll figure it out one way or another. Naomi, thank you for your time, and I'm really excited to talk today.
Thank you so much
You,
for having me. I'm excited to talk with you.
for sure. Could you just give me and our listeners a background of some of your education and experience?
So I have initially, I started as a certified strength and conditioning specialist, personal trainer in college. Basically because I was interested in it. I really believed that exercise heals and interested in human movement. I was a competitive gymnast. And so I later became a coach. Breaking down movement was always something that I just did. So when I became a personal trainer, I really enjoyed being able to help people become more healthy. At a certain point, I realized that the majority of the population has either chronic health conditions, hypertension, diabetes, orthopedic pain, back pain. And what I started to realize was that I really wasn't qualified to help those people as a personal trainer, even with a certification like CSCS, which is one of the highest, it is the highest training certification that you can get. I didn't know what to do with those people. And the problem is that a lot of those people really do need exercise. And so at that point, I decided to go to physical therapy school. I graduated in 2013 from Stony Brook University with my doctorate in physical therapy. And since then have become a board certified clinical specialist in orthopedics and have extensive training and am becoming certified in the Mckenzie technique. And that's a technique to treat low back pain and sciatica type symptoms.
Awesome. Just to give the listeners some context here, we first got connected when I was looking for a sort of a dual therapist slash trainer for my mom, and I believe I found you on Yelp or some website, and then I just let you know what I was looking for, and then as soon as you hit me back with your philosophies and your approach, I was just like, wow, this is perfect. And since then, my mom, we were talking before we started. She talks about you all the time, and she's stronger. She's pain-free. She's more mobile. She's able to be active with our grandkids. And this was a lifestyle I was trying to get her to adopt for over a decade, but it was tough for me to convince her. So I guess as a jumping off point here, in some of the clients that you work with on a day-to-day, if you have someone who is a little more adverse to strength training, how do you show them the importance or convince them to the point where they're consistent like you are with my mom now?
I think that for the average bear, there's a reluctance to exercise. One, because it hurts initially. It doesn't feel good. It feels like a chore. People are so busy. They're struggling just to kind of stay afloat in their daily lives to get everything they have to get done. What I find in my general physical therapy population rather than in my training population is people will come in, I'll say, how are you feeling? I put them through a strength training regimen of some sort the time previous, and they'll come in and say, I feel terrible. I hurt here and here and here and here. And I'll say, okay, what about your shoulder that was hurting? What about the joint? Oh, no, that doesn't bother me. People don't understand at first the difference between muscle pain, the soreness that's associated with the beginnings of exercise, and joint pain. And so first, people don't understand that difference. But what they can see as they continue is that soreness gets better and ultimately results in, guess what? Now they don't have trouble getting out of bed. They notice they're a little more stable on their feet. They notice that they're not as tired. And so if you can get someone past that initial hump of where exercise is really uncomfortable, it becomes its own reward. You do it because it makes your life better. And the same way you brush your teeth every day, maybe you floss, it's a 5-minute a day habit.
Mm-hmm.
Your body needs the same maintenance. And I try to relay that to my patients that, listen, if you don't brush your teeth for a week, what happens? Nobody wants to be near you. Bloody, you smell really bad. You probably have a cavity or two. That's only a few minutes a day. And what makes you think that the rest of your body doesn't need that same maintenance? And so I try to relay that. But I also give it in bite-sized bits, where a little bit at a time, where it's not such a shock, sometimes is more palatable for people. But exercise becomes really important. After age 30, women at a faster rate than men, but men also lose a 0.5 pound of muscle a year after age 30 if they're not strength training. So even if you weigh the same amount, let's say you weigh 100 pounds, and you weigh 100 pounds 10 years later, you have less muscle, more fat. And over time, you may not notice it at 40 or 50, but at 60, guess what? Now you can't get up the stairs as easily. Now you can't get out of bed. And so all these things have implications down the road. If you wait until you're sick and you're 70 and your doctor says start exercising, it's almost impossible because you're not well enough to do it. And so I always try to advocate that this exercise isn't optional. You shouldn't hate it, but it's not optional in it so that you can live a better life.
I love that. And I love the brushing your teeth analogy. And I think for, us in the field and, chronic exercises, it gets to the point where it's such a habit and routine where you almost have to convince people to not do it. And once you're bought in, you understand the benefits and you can feel the benefits. But as you were saying, in that beginning phase, I know PT is evolving and there's more of this hybrid approach with training and it's not just therapy, but I feel like it's tough because either they go in and they feel like they didn't really do anything and they leave and they're like, I'm still in pain, or they feel too sore in the beginning. So it sounds like you've kind of mastered the art of gradually introducing them to a stimulus while not sort of overloading them. And I think as a field, that's probably the most difficult part, is just to get someone bought into that first level, and then once they're there, you hopefully have them for life.
Now, among physical therapists, there's a lot of range in terms of philosophies, and maybe some laziness and exercise prescription, where anybody who's been to PT has heard that 3 sets of 10, and it's described, do 3 sets of 10. A good physical therapist will really take into account what we're trying to get better. So if we're working on endurance and you're getting tired, higher rep volumes, but not just higher rep volumes, but rep volumes where the person's getting really tired, they can't do a lot more. So somewhere between like 15, 20 repetitions. But if the person's not really tired, nothing's changing. By the same token, if the issue is strength and power, like a lot of older adults have problems generating power, meaning force quickly, as in getting up from a chair, there needs to be repetitions performed at quicker paces, higher loads, over a faster pace. And so those types of programs, maybe you're prescribing 3 sets of 5 or 4 sets of 5 for someone like that. And so the difference between a good physical therapist and a great physical therapist is someone who can nuance those types of strength training principles, like an athletic trainer or an exercise physiologist would do, to get a better result. And so sometimes people go to therapy, they don't feel a thing. Maybe they get a little better just because they're moving their body, but you really want someone who's thinking about what are we trying to accomplish and tailoring their exercise prescription based on the types of things they're having trouble doing.
I love that approach. To me, I don't want to point fingers, because when you're going through physical therapy school, you have to develop such an expertise on all the different, soft tissue injuries and all of the specific skills that you need. But it seems like there's more of an awareness of sort of being a little more individualized in the prescription. And I know just from a recent experience I was working at a performance facility where we did training and we outsourced our therapy, and we had an intern who was a physical therapist in the NBA, and she realized that her training from school, it didn't really prepare her to go from that late stage rehab into
Absolutely.
Sort of return to sport. So I know that there's this awareness of, okay, now that you're not in pain, how do we sort of bridge that gap? And it sounds like you have that approach, and I'd love to dive into some of the more minute details of your practice, if that's okay.
Sure. Yeah.
All right.
I agree with you in that there is a gap in that phase where the person is not in pain, but not necessarily performing up to the same athletic ability, even if it's the weekend warrior, that insurance does not cover that gap. But it's really important. And no, that's not specifically part of your training. And so as a consumer, as someone looking for that, it's really important to find a therapist with a CSCS, a clinical, a certified strength and conditioning specialist, or an athletic training background, who's trained in being able to transfer that over, or a sports certified clinical specialist. Somebody that's able to do that, I think, is helpful for a lot of people.
Definitely. Two of the topics that we've discussed sort of off air center around tendon health and joint health. And I know this is something that affects, all populations at some point, but even athletes and just aging individuals. And we were talking about sort of the prescription of isometric exercises and eccentric exercises, specifically for tendon health. I know my mom is dealing with some stuff around her knee and her shoulder. So from your perspective, when are they appropriate, and how do you approach someone who's having some tendon issues?
Isometric exercise can be a really effective tool for pain relief. When somebody's in an acute phase of something like a tendonitis, a lower load, frequent isometric exercise, and isometric exercise for your viewers, I'm not sure what the skill level of what they are, but just where you're contracting the muscle, but not to its fullest extent, you're just repeatedly contracting it, can take somebody out of that acute inflammatory phase and help calm it down. It's good for pain relief.
Mm-hmm.
As the person's inflammation calms down, they're a little further along in the healing process, we can increase the intensity of that isometric, increase the demand on the muscle. Things like a wall sit can be helpful in an early stage patella tendonitis at a higher angle of bending the knee, so not too deep, so that you don't stress the joint. As the person goes into a more chronic stage of a tendonitis, there needs to be some progression into concentric and eccentric exercise. Concentric, if you're thinking of a bicep curl, bringing the weight up, and the eccentric, lowering it down. And so over time, the best way to heal that tendon is to perform eccentric exercise. So in a squat, it's the lowering part. In a bicep curl, it's the lowering part. And that's the part of the contraction that creates little tears in the muscle and in the tendon and actually heals it. And so as someone can tolerate it, that's where you want to start introducing it. Now for a chronic tendonitis, you actually do have to induce some pain, which is one of the few times in therapy that we want to provoke true pain is when we're healing that. So a 3 out of 4 out of 10 pain during the exercise, doesn't last too much longer after, is necessary. And that will mean increasing the load over time to eventually heal the tendon over 12, 16 weeks, sometimes even more.
That makes complete sense. So it sounds like you know, in the initial stage, you start with isometrics, and then to sort of stimulate healing, you go into more coupled actions where you want to sort of have some adaptation. And if that's for tendon health, how does that differ for someone who has maybe a muscle strain? If you feel a strained muscle, should you try to strengthen it or stretch it? What's your approach, for muscle?
For a muscle strain, that can vary, right? A strain by itself, when you say, oh, I pulled my hamstring, it can vary anything from just a little annoyance to being a big problem. A strain of any kind of a muscle is a small tear in the muscle, right? Not always a big deal. When you exercise, you do get some tearing in muscles. Modified rest, so not complete rest, but a modified rest is going to be the best thing. And so in a slightly strained muscle, yes, you can do some isometrics, some gentle walking, some foam rolling. All those things can be helpful. In a strain that's more severe, really a muscle tear, there's going to be more of a prescriptive process where we really start with very gentle isometrics and progress it very similarly to how we would treat a tendinopathy, tendonitis.
That makes sense. And I know most people, when they hear a strain, it's either there was a specific event. So I was running or I was playing tennis, and you feel something, and then there's like almost like the acute process. But if you have a different approach, and I'll get very selfish here.
Sure.
My hip flexors, I was biking for a little bit, maybe for a month. And now I just have a chronically tight hip flexor. I've stopped biking, but I'm in this unique phase where it's painful when I do most things. I'd say every day it's about a 5 or 6 out of 10. And I'm in this gray area where I don't know if I should strengthen it or stretch it. Are there any indicators that you look for, stretch or strengthen?
Jake, that is a great question. Yes. So I'll start by saying that about half of hip pain and groin pain and hip flexor pain is part of your hip. About half of hip pain has a spinal origin. And so even when we feel pain in our hips, groins, the first thing is to screen out the spine. From there, testing muscle strength. Yes, we can resist it with our hands. The best gold standard is to use something called a dynamometer, where you're holding a handheld device and we can measure it objectively side to side. But very often, a weak muscle is a tight muscle. And the reason for that is if the muscle isn't strong enough to perform the activity you're asking it to, it's going to get really tired. It's going to get overworked. It's the same way somebody who's deconditioned, they go to the gym, they start exercising, man, are they tight all over their body. Well, that's because they're not very strong. And so they're going to feel super duper tight. And the same thing can be true in what feels like a tight muscle, is to strengthen it. At the same time, isometrics, even if the goal isn't strengthening, can help reduce some pain. So when we're looking at tight muscle versus not, we want to measure the range of motion side to side of the muscle that's tight. We want to consider whether or not there's something going on in terms of the mechanics of the hip itself. Is the joint tight? Is the hip gliding up as you bring your knee up when you're biking and causing that pinching and tightness? And maybe it's more of an irritation. So kind of a different, this needs to go on there. But in general, for a tendonitis early on, especially, you don't want to do a ton of stretching of that muscle. All it's going to do is irritate and inflame, which is a tendency, right? It feels tight. Let's stretch it. And you say to yourself, well, it's not really getting better. And then the question is, listen, is it a nerve? Because if you're stretching it and it's just getting irritated, nerves get irritated. So I think in your case, it would be interesting to see how much of that was coming from your back, how much of this is mechanics, is your hip capsule getting tight and we just need to glide that hip down so that you're not getting that irritation in the front of your hip. But that's something we can talk later about, and I'm happy to help you.
Yeah, I appreciate it. I definitely, I had the awareness of, hey, it's probably weak, but it's very difficult for me to feel something tight and not stretch it. But today, it's been almost over a month now. Today I was warming up and I'm like, okay, like stretching isn't helping. So maybe I don't want to hijack the conversation, but I will try to do some isos and some strengthening.
I'm happy to help with that later. I will say there's a ton of focus on strengthening glutes. And that's a great thing to do. And there's a ton of focus on strengthening hip abductors, and that's a great thing to do. Hip flexors tend to be weak in people, and it's sort of popular and important to stretch the hip flexors. We sit all day, so the hip flexors can get tight, the muscles in the front of your groin. However, there's probably not enough focus on just resistive exercises for that muscle.
Just off the top of your head, do you have any places that you start from an exercise prescription standpoint for the hip flexors? I don't want to put you on the spot here, but maybe some of our listeners could look them up.
So even just a banded standing hip flexion, you put the band around your feet and you're kind of lifting the knee, you're working the hip flexors there. Various exercises, if you're hanging from the bar, pulling your knees up, the progression of that is bringing the knees up straight. Some gyms have a multi-hip machine where you can work your hips in all four directions. Most physical therapy clinics have that. There are tons of ways, and happy to share some of those with you later.
Thank you. I appreciate it. So we've covered tendons, we've covered muscles, and I know I call my mom every week, and last week she was telling me that you were focusing on joint health and you were doing some stability training. What's your approach for improving or maintaining joint health?
Sure. Maintaining and improving joint health is going to be different for everybody in different life stages. depending on what's going on, without sharing too much of your mom's personal information. If somebody has a condition like a rheumatoid arthritis versus an osteoarthritis, and I'll share that a rheumatoid arthritis is more of a systemic inflammation that attacks the joints, and osteoarthritis is more of a wear and tear type of arthritis. Sometimes people have both. And in a rheumatoid arthritis, where there's just inflammation throughout the entire body affecting the joints, it's important to strengthen and stabilize without irritating the joint. And so in somebody like that, I love to use isometrics because you're not getting a lot of that back and forth, the friction. And that kind of strengthens the muscles, probably not as effectively as a regular concentric or isotonic exercise, but it does it. And you can add weight to those isometrics, and you can take one of the limbs away. So if you're doing a bridge exercise on your back, you can take one leg away and have them hold it up. The person can still be challenged. There's less irritation. In somebody with osteoarthritis, where there's a lot of wear and tear, there may be a particular range of motion that's irritating. So for example, a shoulder, somebody may be fine in this range, elevating their arm, but man, are they not okay up here, or they're not okay when they're out here. So strengthening in areas where they don't experience the pain and just working in through pain-free motion is helpful. That said, there are techniques that a physical therapist can do to restore normal mechanics and get better mobility of the joint capsule so that there's less wear and tear on the joint. And so you can think of it like a drawer that's not in its track. If it's just not right in its track, and it's bump, and you're going to get wear and tear in the drawer, especially, you're buying IKEA furniture or something like that. It's like bump. What the joint mobilization does is make the glide smoother so that there's not as much wear and tear, so they can move the joint through its full motion. And then there are some prescriptive exercises to kind of maintain the improvements they gain in the orthokinematics of that joint. So
for the mobilization, I know I'm often out of whack, and I think most people, they get off track, like in your draw analogy. Is that something that is best done with a physical therapist like yourself working directly on you to know sort of which direction that it needs to go? Or is there sort of a general progression of movement that you can do at a certain joint that's going to, put it back in place?
There are common ways in which people can move that in general, there's patterns in terms of most commonly directions in which the joint can kind of glide and cause pain. And so like in a hip, generally stretching the hip flexors, like a lunging stretch, is going to be effective, or a stretch where you're bringing the foot up and stretching down to bring the ball of the hip down. I think for the layperson to do a general stretching and mobility program for a joint as part of what they do, in addition to their cardio, their strength training, in order to do that pain-free, there needs to be some mobility happening. And very often people forget about that piece of it. Our heart, most important muscle. Cardio, got to do it. Strength training, it's important to be strong. People do that. But a part of being healthy is being able to move well. And even though you're not exerting yourself and feeling like you got a great workout from that, spending time working on mobility may not be making you tired at the end of your workout, but will allow you to move better for those more intense workouts. And so part of moving well, even in our 30s and 40s, it's important to be able to bend over and get something from the ground without doing that And I think people start to experience that pretty early in life. And so making sure general mobility exercises are part of your general maintenance program is worth its weight in gold, really, and will let you have a longer, be sturdy and do what you love longer. But
My,
if you can't do it, if you can't do it on your own and those general stretches aren't working, that's when you go see someone.
yeah, I was going to ask you, we've touched on a lot of great concepts and topics. You've stressed the importance of mobility, strength training, and endurance training, and we've touched on some specific, things to look out for. But if somebody, say, doesn't know the specific exercises, are there any resources you recommend for where someone can start on their own, or do you recommend going to a professional? And maybe if it is the latter, are there any things that you would look out for if someone is looking to, start their own holistic fitness journey?
If somebody's looking, depending on their fitness level, to get some kind of structured program, depends on the level. For general exercise, I love BJ Gador. He has an app, and his app is called the Daily BJ. It's a good name. But he has pretty accessible short exercise programs. I think that in general, his programs are pretty sound. If someone has pain, I think there are certain things that may irritate them. But in general, I think that's a good place to start for someone that doesn't have a ton of exercise background. For someone that does have some minor joint issues, prehab guys offer some good programs that you can do online. And then John Rusin has a few different programs. One is a beginner strength training program where it's just basic lifts and goes through ways to do it. Again, if you have pain, it may not work so well for you. But then he has more advanced. I do his functional hypertrophy program, which is it's time consuming, but I think it's a good program. Again, if you don't know how to modify these things, it's not always that easy. Jake, did I answer your question? I may have gotten off track there.
Oh no, that was
Okay.
perfect. Honestly, this is the, I think, 11th recording that I'm doing, and I worry that I talk too much theory without specific practices. So this is great to have some very concrete resources that people can go towards. And I haven't, in all the episodes I've done yet, I haven't linked to anything, but I know what most podcasters say is you can find this in the show notes. So all of the programs you recommended, I will link to them in the comment section. And that was perfect. I'll check them out myself. I just have one last question for you, and it's a pretty, I don't know, general one in nature, but I'll try to make it more specific. Again, we've covered tendon health, muscle health, joint health, specific exercises for how to start. Another common issue is lower back pain. And just to give you a case study, my fiance and even myself, a lot of people have disc issues, and I have a herniation and she has one as well. And I know maybe as a separate conversation, we can talk about sort of I know a lot of people have asymptomatic herniations, but specifically in your case, if someone they're in pain daily, how do you go about navigating the process of either getting pain-free or knowing if it's time to get surgery? How do you sort of approach that?
I'll start by saying surgery is a last resort. That's something you do want to avoid. Now, you can always find a surgeon that will cut you open, right? Red flag symptoms for a herniated disc radiating down your leg, you have progressive weakness in your leg, where you're kind of dragging your leg. It's getting worse, not getting better. Changes to bowel and bladder, numbness in between your legs. That is a rarity, right? Now, to backtrack a little bit, you and your fiance have herniated discs. So do I. Well, guess what? Most people above, let's say, age 30 actually do have herniated discs. And at any given time, most of those people are asymptomatic. They don't feel pain. And so if you gave my whole office building filled with people over 30, a lot of them would show up with herniated discs. Doesn't mean that person's going to have pain. Now, that word is very scary. Oh my God, I have a herniated disc. That herniated disc only causes problems when the disc is touching the nerve, right? And there are things that we can do to kind of reduce the disc back in. I think it's important to know that these things are extremely treatable conservatively. Okay. There are a number of ways to treat it. One way that we can really effectively treat this type of thing is with something called a Mckenzie approach, where the idea is that there's a particular direction of motion based on where the disc has kind of come out and affected the nerve. We can move the person in particular ways in which will help bring the disc back in. That said, the Mckenzie approach I've used, it's part of my practice. It's a great tool in my toolbox. I think it's also important to train stability musculature. Your core, the purpose of the core is not to flex the spine in a crunch, but it's really designed to keep the spine stiff as you move your extremities. And so there's less wear and tear. So treating both ends of that is really important, and the way in which we treat it will vary depending on the patient. In general, spending more time walking is going to be really helpful. Spending more time lying on your belly rather than sitting is going to be helpful. Again, not sure if I'm veering away from your original question, but even if somebody is having a herniated disc that's causing radiating pain down their leg, that pain may be extremely excruciating and feel terrible. You may be offered an epidural. It's often not necessary. We can treat that really well. My suggestion is don't let it become chronic. The more chronic it is, the harder it is to treat it. But it's a really important topic. I could speak for hours on it. One of the reasons it's such an important topic is, it's one of, as a society, one of the greatest costs to our healthcare system. Is that, and people miss work. It's one of the highest reasons people miss work is because of that. And so, yeah, back health's really important. I think looking for both a Mckenzie therapist can be very helpful, but also someone who's maybe not treating exclusively Mckenzie, but will also treat the strengthening aspects of the core, etc. So
that was perfect. I think maybe we can have you back on again for another episode where we talk more about the back and prescription. Absolutely. And maybe we could do some case studies with my hip and my fiance's back.
Absolutely. I'm
awesome.
happy to talk to you, offline about that anytime.
Thank you so much. Is there anything else that you want to get out there while you have the audience, my massive audience of 40 subscribers?
Okay. soon to be 80, right?
Yeah, hopefully.
I would say that don't look at exercise as a punishment. It's not. It's truly the best thing you can do to age happily and well. If you don't know what to do and how to go about it, get some help. Get a good trainer, get a good physical therapist who does training. Make it a part of your life. It doesn't have to take over your life. If you give yourself 15 minutes a day, half hour a day, whatever you can do on a consistent basis, you will thank yourself more than you have any idea. In 10 years, in 20 years, it's the best way to age and the best gift you can give to yourself. And doing that, even though it's hard to make time for it, it's harder to be in pain. So.
Wow, I'm sold. And thank you so much for
Well,
your
I
time,
already knew
Naomi.
you were sold. You're no.
I appreciate this, and I appreciate you, especially helping my mom. And I would love to have you back on again soon.
Absolutely, anytime. And it's been a pleasure working with your mom.
All right, thank you. Have a good rest of your day.
All right.